All right, so we are going to be going over today how to perform the barbell RDL correctly. The reason why I want to do this is a couple different things. This is an exercise I will use from both a rehab and a training standpoint. For rehab, specifically when we are looking at coming back from a lower back injury or a hamstring strain in a field sport athlete, the RDL is a massive pattern that we want to make sure that they can master and perform well and correctly. And then from a training standpoint, it's the same thing as a powerful stimulus for the posterior chain. Now, in this case, from a training standpoint, it's a little bit different in an athlete versus like a CrossFit standpoint in terms of how we will implement it into a training program. From an athlete standpoint, we're probably gonna use it as a little bit more of, we could use it for both an accessory or a main movement. From a CrossFit standpoint, it's probably gonna be more of an accessory movement to the deadlift more than anything. So we're gonna go over that today, some of the common pitfalls and compensations that I see athletes perform. And really all you're gonna need for right now for this tutorial is a barbell. You can use some light weight for this tutorial if you want to. And then preferably if you have a pair of safety bars like so for an overcoming isometric I'm gonna show you. So we'll get right into it here. So the barbell RDL, more than anything, it is a hinge. And a hinge pattern is probably one of the toughest things it is to teach people across the board, whether they are football players, baseball players, any other type of team or field sport athletes, and then CrossFitters and active adults. The hinge, more than anything, is the ability to load the posterior chain, specifically the glutes and the hamstrings. What happens more often than not is that people turn this into essentially a low back dominant movement, which we don't necessarily want. Is the low back going to be active in the RDL? 110%, but statically, isometrically. We do not want there to be a dynamic movement through the low back during this. That's typically where these problems arise more than anything. So when we look at just the basics of a hip hinge more than anything, it's two parts. You can take whatever stance you feel is most comfortable, whether that is a clean grip, a snatch grip, or really just a traditional deadlift stance. I personally prefer to be in more of a clean grip stance. That's just my preference. I leave it to the preference of the athlete, or if they have a specific goal that we're trying to go towards, we'll gear towards that. So all you're gonna wanna do, without the bar just to start, you're gonna wanna go ahead, you're gonna have a slight bend in your knees. So I call this unlocking your knees, a soft bend. It should be about a 10 to 20 degree bend. Once those knees bend, they do not bend anymore. Then all we're gonna go from here is you're essentially hinging and loading into our posterior chain, our glutes and hamstrings. So from here, I'll push it straight back. You should feel some tension in glutes and hamstrings right away, and then you're coming back up. The common mistakes I see when they as people bend their knees, when they go to load back, they tend to straighten their knees like this, and then you look at my feet are starting to come up off the ground. We do not want this to be a heel heavy movement. We want full contact within the ground, big toe, little toe, heel, all in equal contact with the ground. You can think about gripping the ground too if you want to. So that's the first compensation. The second compensation is when you have that slight knee bend, as you move into that hinge, you re-bend the knees, and now it's turning into a squatting movement. You can feel the minute you do that, you're gonna take tension off the glutes and hamstrings. So we do not want either of those two movements. So again, just to bring it all together, we do not want a straightening of the knees coming back on here. We also do not want a re-bending of the knee. The other side of this is from the low back standpoint. What we don't want is we don't want it to be this movement where I'm looking up. IQ, pretty much find that intersection between where the wall, if you're in front of the wall, where that wall meets the ground more than anything, you find that's like a 45 degree angle and you stay on that. If you keep your head kind of cranked up like that, you're gonna end up probably jacking up your low back. And then the fourth mistake is bar path. You see people get a little bit too far away out in front. Ideally, you like to kind of have it be just pretty much right along the front of your knee and your shin is what you're going towards. So how we put it all together? We're gonna grab the bar here. We're gonna start at the bar in our hip crease more than anything. You are then gonna have a slight knee bend. Again, once those knees bend, they do not bend any further and they do not straighten anymore. And then all we're going from here is we're going straight down. You can go to pretty much like upper part of the shin, come up, squeeze the glutes. So you'll find, and you'll see for me, I don't really cue for the RDL specifically, I don't cue going all the way down to the ground. Why? Because I found this position, majority of people to go all the way down to the ground is probably going to cause a lot more of this movement to come from the low back versus a true hip hinge, especially when we're teaching it from a rehab standpoint. So again, slight knee bend. Bar stays close, pretty much going right to below the knee. You should feel some tension there, and then you're standing up nice and tall more than anything. So that is one way that we go about training the RDL. The second way can be from a overcoming isometric into the pins. Now what I will say is this can be a very powerful and very potent stimulus more than anything, so you really want to dose this properly. So what you're gonna do, you're gonna have these safety bars here. You're gonna have them relatively, I would say like they're right now, they're probably at about knee level for me, which I think is perfect. So you're gonna essentially get in that bottom position of the RDL. You're gonna get set up in that bottom position. So you're gonna be here, in your normal position. You're in that hinge position, the bar is just off your knees, and then you're pushing into the ground. So take tension out of those safety pins just like that. Now, what you will see is I am pushing through the ground. I'm not shooting my hips up, I'm not going to my back. This should be pushing through the ground more than anything, and then relax. If you are pushing through the ground, you will immediately feel your glutes and hamstrings kick on. If you do not, then there's something that you need to change in your form. So again, that is really the best two ways that I like to, one, cue the RDL, coach the RDL, avoid some common mistakes, and then really how you can go about executing it from a movement standpoint. So if you have any questions on how to perform an RDL, you've had trouble with them before, go ahead and leave a question below, or like, comment, and subscribe to our content.